Many other jurisdictions in Canada, as you are acutely aware, are getting rid of vaccine cards, ranging from Alberta all the way to Quebec, with a timeline largely through this month and into March. Why is British Columbia one of the outliers here in terms of keeping the vaccine card in place? Is this about science, or is it about confidence / trying to get people to still get vaccinated?
Well, I believe it's a combination of all of those variables. As you know, the vaccine card uptake in British Columbia was swift and it was overwhelming. And it gives people comfort when they go out into social settings, particularly seated events, that the people that are around them have taken the same measure to protect themselves. I'll allow Dr. Henry to talk about why this science is important. But again, British Columbians have been comfortable to be outliers on a number of fronts. And we've done so because we want to ensure that the sacrifices that people have made over the past 2 years are not in vain. And therefore, a measured approach is how we've addressed all of these issues going back to 2020, and we'll continue to do that. I believe that British Columbians want us to chart a BC course based on the variables that come into play in our communities, based on the level of acceptance of the measures that have come forward. As all three of us have said repeatedly, the success of our approach to COVID has been a direct result of British Columbians acknowledging that they can take personal actions. They can get vaccinated. They can follow public health guidelines. They can wash their hands. They can stay at home when they're sick. And most importantly, they can respect other people's comfort levels. And the immunization card has a role to play in that. I don't know if you want to add the science piece to that.
So we've always had a bit of a different approach in use of the BC vaccine card, and it's for very specific settings that are the higher risk settings, that are indoor settings where people often have to take their masks off for a period of time, or when you're in settings that are indoors with people that you don't know and you don't know their vaccine status. So those are important things. And what we've done is we have taken off restrictions on capacity limits, for example, because we have the mitigation of the BC vaccine card. So we're different from Ontario, from Quebec in that regard. So it has played a role. It's played a role in reducing and not eliminating the risk of transmission, and we know, especially with Omicron, that it can still be transmitted, although that is less, and particularly less in people who have their booster dose on board as well. But we also know that in those indoor settings where it's applied, where we can have quite large numbers of people together, that even if there's some transmission, the amount of immunity from vaccination means it's not going to be spread as widely, and we're not going to get people getting seriously ill and ending up in hospital at the same degree. So there are reasons that we're keeping it in place, but really it's being able to take away capacity limits and still have mitigation of risk in those settings. So we've used it somewhat differently. Having said that, we'll also be reassessing when its value is no longer needed, and it has to do with the amount of transmission we're seeing in our communities and where we no longer need to mitigate that risk and people are more comfortable with being together in those indoor discretionary settings.